One of the major contributors to injuries related to the healthcare industry is the frequent heavy lifting and repositioning of persons that exceed the lifting capacity of most caregivers. There have been a great deal of studies showing that simply training caregivers how to practice good body mechanics just isn't enough to prevent injuries due to high risk for injury related to overlifting while they're lifting the weight of an adult. Now, if this weren't enough by itself, the risk is increased due to the nature of healthcare provider work environments, such as confined space in bathrooms, busy and cluttered rooms, and even furniture itself. They all provide barriers to proper use of good body mechanics. We've even seen that repositioning a patient in bed can be a risk for injury due to the size of the bed not allowing for the caregiver to bend at the knees and use their legs so that they have good back posture. Now, due to these factors, there were almost 250,000 occupational related injuries reported, with an additional 343,000 jobs being created between the time that report was put together and now. We know that these musculoskeletal injuries to the back, the shoulder, the upper extremities are all going to increase. There are many benefits to implementing an ergonomics and safe lifting program. But in order to realize these benefits, one must include worker training on the use of the lifting devices, a written lifting policy, as well as the proper lifting equipment itself. If you remove any one of these from the safe lifting program, you have a perfect setup for a lot of busy work without the beneficial results. So what are those results? Well, that's a great question, and one that I think has to be answered at the beginning of any health and safety or accident prevention program in order for the rest of the education to be effective. So let's take a closer look at 3 distinct beneficiaries of these benefits. First, the patients. When safe lifting and moving practices are implemented, the quality of care, the resident safety, and overall comfort and satisfaction of service improves drastically. And that's what healthcare should be about, isn't it? So secondly, the employer benefits. Not only does the safe and injury-free lifting save tens of hundreds of thousands of dollars spent in direct and indirect medical costs, it saves thousands of dollars in workers' compensation rates, lost productivity from lost work days, and overtime and expense related to temp services or new hire costs. Stronger employment retention is another key facet to this. And let's face it, when businesses are growing and making money, there is job retention and creation, which leads to money circulation in society, and that just makes great economical sense. Now, lastly, you benefit. And if you have a hard time understanding the importance of the last 2 reasons for lifting and moving safely, you should at least do it for you. A whole segment could be devoted to how much a soft tissue injury related to lifting or moving patients can alter your lifestyle in an extremely negative way. But whether it simply prevents you from doing the things you love to do that require a healthy body, or the devastating effects that chronic severe pain can cause, one thing is definitely for sure. If we as caregivers don't practice the principles explained in this training, injury is imminent and will alter your lifestyle negatively forever.